First of all, when we hear the statistics, which are so devastating, with half of the deaths in Maine being in long-term care facility, a third nationally, my heart just goes out not only to these patients, but to their families and to the staff of nursing homes and other assisted living facilities, congregate care settings. They're all praying that COVID-19 does not find its way into their facility. Yesterday, the Government Accountability Office released a report that found that nearly half of the more than 13,000 nursing facilities surveyed had infection control deficiency citations in consecutive years, which the report called an indicator of persistent problems. Yet, as Dr. Konecka said in her testimony, even the highest quality nursing homes have been largely unprepared. And what we've usually looked at, the ratings by CMS, the number of stars, has not proven to be a reliable indicator of which nursing homes are safest in this environment. And indeed, one of the worst outbreaks in Maine was at a nursing home that had 5 stars. So I think what we're learning is that healthcare providers are rethinking some of their initial assumptions, and that we need to think more about hospital discharge planning. But Dr. Konecka, I want to have you expand a little bit more on what we can do. I believe that you recommended universal testing for every nursing home resident and staff, which I think is a good idea and have been recommending. How often, however, would you have to do that? And would that allow family members who have been tested to finally be able to visit their loved ones? And I hope we can unmute Dr. Konecka, because I can see that she's responding, but we can't hear her.
Oh.
Doctor, go ahead.
Can you hear me?
Yes, thank you.
Okay, great. Yes, thank you for that question. I think that we're learning a lot as we go about how best to fight this virus in nursing homes. And so we don't have, unfortunately, great data yet on exactly what testing strategies have been used and how successful they've been. So a lot of what we're going on is anecdotal evidence. But what I can say is that there have been a few key lessons learned. And one is that it is very important to test all residents and not wait until residents are asymptomatic, because, until residents are asymptomatic, because by then it's too late. There is asymptomatic spread, and given the close proximity and the fact that staff go from resident to resident every day, the virus, until people get symptomatic, can spread throughout the facility. So we've learned that lesson, that all residents really should be tested, and not only tested, but tested regularly. So what I've heard from geriatricians is generally weekly would be good, at least bi-weekly, so that residents can then be separated and the transmission can be stopped. I'd say it might be very hard, especially as we relax some of the restrictions on visitors, which is essential, as you mentioned, essential to prevent the sense of social isolation among our seniors. As we relax those restrictions, it's going to be very hard to prevent all cases in the nursing home. The key then is sort of a rapid response to prevent transmission to the rest of residents and staff.
Thank you.